Hi, welcome to the Destin Business Forum brought to you by the Destin Area Chamber of Commerce. I'm your host, Amy Perry, and our guest today is Dr. Kyle Chavers. You have Foundations Medical Center, correct?
Yes, ma'am.
All right, so tell those of us who don't know what that is.
Okay, we are a medical office where we focus heavily on functional medicine, anti-aging medicine. We're conventionally trained medical doctors, but got into functional medicine after frustration with the conventional medical model. We started out in conventional family medicine and went into medicine to help people, to heal people, to make a difference. But learned pretty quickly that conventional medicine is an acute care model, and so it's this acute care practice that's great for acute problems, but most of the diseases in our country are chronic in nature, and so
let me make sure
functional medicine.
Let me make sure I understand that. Somebody comes in with a heart attack, that's acute care. You're treating their emergent situation.
Absolutely.
And what you like to do in your practice, or are trying to do more, is, all right, let's prevent you from having this heart attack.
Yes.
Let's prevent you from getting diabetes, or let's try to get you off of some blood pressure medication.
So there's no better system than conventional Western medicine for acute problems. Heart attacks, strokes, trauma.
Agreed.
Things like that need to be dealt with acutely. But things like obesity, diabetes, high blood pressure, chronic pain, autoimmune diseases, these are things that are chronic and require a much more holistic approach, really looking for the underlying cause of the disease as opposed to an acute quick fix or an acute treatment.
Got it. So people, if I went to you, I would want to see you a lot for non-acute things, but I wouldn't want to have to walk in. I mean, you could treat it, but the goal would be not to have to see you for heart attack or diabetes or something like that. I would imagine that would...
The goal is prevention of disease and reversal of disease that already exists. Absolutely.
Gotcha. Okay, we were talking a little bit before we started filming, and I asked you, what types of things do you address? You talked a little bit about gut health, and you have some supplements here. We'll talk about that in just a minute.
Okay.
And you talked about hormones. Now, when I hear hormones, I usually think of like women have that issue later on in life, but you can also treat hormones for men too, I would.
Absolutely, yeah. We treat a variety of conditions. Really, any medical problem we address from a functional perspective. Big things that we see, or things we see most often, are gut issues. Most people in our country have some type of gut problem or gut imbalance. We see a lot of chronic fatigue issues, and then the hormone issues, because eventually if you live long enough, most people, men and women, are going to end up with hormone issues, and it is thought of more of a female problem with menopause and things like that, but we also refer to something called andropause, which is when men's mainly testosterone starts dropping as they age and can result in a lot of chronic problems, a lot of symptoms. Okay,
and $50,000 question, do you do hormone replacement therapy?
We do. We do offer hormone replacement therapy. We use bioidentical hormones, and we use a variety of different methods. So we do sublingual hormones, we do topical hormones, which is like a cream or a gel or a patch. We do injections, and then we also offer testosterone pellets, which are kind of a new up-and-coming way of hormone delivery.
Is that like
had
a
great
slow,
results. Yeah, exactly. It's we insert a little pellet under the skin, and so you get this slow release of hormone over 3 to 4 months. And so it's more of a physiologic way of balancing hormones.
Okay. We talked about gut issues, and I know you sell some supplements. Do you have a supplement side to your practice? We
do. We have a small retail shop where we sell pharmaceutical grade or medical grade supplements, and those are certainly targeted at certain medical conditions. I prescribe those for patients that I see, but we also have people that are pretty healthy but want to get some extra treatments or extra things for their health, and they walk in, buy supplements from our shop. So we certainly have walk-ins as well.
And just quickly, I know we've got a few right here. Tell me what these different ones are.
So we brought a couple of our GI supplements. So people with IBS, constipation, diarrhea, inflammatory bowel disease, all these gut problems, we use a lot of medical foods. So this is kind of a detoxifying medical food that helps kind of clean the gut out a little bit.
Okay.
L-glutamine is an amino acid that's important for cell regeneration and cell growth in the gut, for getting rid of the bad cells, growing good healthy cells. And then this is a formulation of lots of anti-inflammatory compounds that just kind of help calm down the gut, calm down inflammation, and help restore balance to the gut.
Okay, I'm glad you brought up inflammation. I guess the internet's a great and an awful thing, but I've read about inflammation, bad. But you said we actually need an inflammatory response, right?
Yeah.
Like if we get cut, that's a good inflammatory response. Is that?
Yeah. So acute inflammation is what happens when you get injured, when you get hurt, you get sick, and that can be life-saving. So these inflammatory cytokines and factors come. An example is a laceration. It gets red, it gets swollen, things come to that wound, and it heals. The problem is when you have chronic inflammation as a result of a poor diet, of poor sleep, lack of exercise, overstress. Yeah, nobody's stressed, right? Too much stress, and just kind of a poor lifestyle. That leads to chronic inflammation, which is what we believe is really the root cause of lots of medical conditions and lots of diseases.
So the goal is to kind of calm that.
The idea is to calm down the inflammatory process, get rid of the chronic inflammation, and when you do, it allows the body to start healing and repairing itself.
You have an IV spa. I've heard of those. I've been to one. Tell the viewers what that is exactly.
So we offer essentially two different kinds of IVs. We have sort of our boutique line, which is for people who are generally healthy. They want a boost in their immune system. They need an energy boost. They maybe are a little jet lagged, a little hungover, need something to kind of get them going. And then we have our therapeutic IVs, which are more on a prescribed basis. So for people with certain medical conditions that we tailor specifically for them for their particular problem. So those are things that we prescribe, but also people walk in or call and schedule just to get on an as-needed basis.
Okay, and I would think that everywhere you look, there's the flu. Not going to prevent the flu, but it could boost your immune system.
Yeah, and maybe prevent the flu. We have lots of people. Our Immune Enhance IV, it was a combination of vitamin C, of B vitamins, of zinc, which are essential for building up your natural immune system. So in a lot of cases, we do prevent illnesses, viruses, the flu, or give your body the best chance of healing quicker if you do get sick.
Got it. And the advantage is that it goes directly into your vein, gets it quicker.
Right, straight to the tissue. So you bypass the gut. You don't have to worry about digestion, absorption, filtering through the liver. It just goes straight to the tissue, so you get the highest level, blood level of the nutrients.
Okay. And we are way past out of time. I'm just going to mention that you have an infrared sauna.
We do.
That can be beneficial for a lot of different things.
Yes.
Can they check your website to find out more about that?
They can. Go to our website, foundationsmedicalcenter.com. It's got all the information about our IVs, about our hormone therapies, and about our sauna there.
Okay. I'm going to see if I can get you back for an entire show.
Okay.
All right. Thank you. We'll be back.